feel like I'm two completely different people. And maybe not completely different, but I feel like the person that I always thought was trapped inside the fat person.
Just having that self-confidence back that, I'm not so worried about people watching me or looking at how I'm eating or walking down the street or looking at the clothes I'm wearing.
I know that I'm more optimistic. I know that I'm going to probably live longer and I'll probably stay healthy longer.
Hello, my name is Dr. Sunil Bhoyrul, and I'm the medical director here at Olde Surgical. Together with my fellow surgeon, Dr. Gina Fahrenholt, and our wonderful team, I'd like to welcome you to our video seminar. I know that for so many of you, even the decision to call the doctor about losing weight can be a very difficult one. And so I'm so happy that you're here, and I really hope that you find the seminar helpful. In this seminar, we will talk about the illness of obesity, and we'll tell you about the different types of surgery for people who are overweight. You'll meet Dr. Gina Fahrenholt, and she'll even tell you about robotic surgery and cosmetic surgery. We will also tell you about life after surgery and about our program that includes our very own mobile app. In fact, you'll learn why our program is truly unique and why we have won numerous awards for our passion here at Olde Surgical. We will also introduce you to some of our patients so you get a real-life idea of what to expect after surgery. If after all this information you want to meet us, you want to begin your journey, we'll tell you what you need to do next.
Physically, life was very limited back then. I had trouble standing for over a period of 3 to 5 minutes. I couldn't walk, like walking to the mailbox from my apartment, which was one door away, was labored. And I was very isolated, and I didn't go outside ever because people were horrible, and people stared and they made comments, and I've been spit on, and people would drive by and yell foul things and honk, and just my apartment became my prison, and I didn't leave, and I didn't do anything. I didn't open the door unless it was to accept the food delivery. I've always had a kind of dangerous relationship with food, and I was a foster kid, and my life was very unstable and inconsistent, and there was a lot of abuse and a lot of insecurity, and I learned kind of who I was or what I meant to people or things through food. Like most in my family, it's just a thing. Most of our affection and social interaction happened around food, and so even when my mom wouldn't talk to me, if she cooked, I knew she was in a good mood. So I depended on food to get everything that I didn't get as a child. Before in my life, future was just like something that you see on TV. I didn't think that 5 years ago, I didn't think that I would be alive in 5 years, and I didn't plan for that.
Obesity is a lifelong struggle for all of our patients. Despite their best efforts and commitment to diet and exercise, most find that they ultimately gain their weight back. It turns out this is not your fault. Your brain is working against you once you have gained weight. After weight gain, attempts at weight loss result in your brain telling your body that you are starving and ultimately trying to put the weight back on. This is why most of our patients come to see us for surgery. We use the relationship between your height and weight, or your body mass index, to calculate your degree of obesity. A BMI, or body mass index, of greater than 30 indicates obesity. If you do not know your BMI, you can click here to calculate it. At Olde Surgical, we know that weight is not the sole predictor of health. We use a tool called a body composition analysis to assess your muscle mass, metabolism, and percent body fat. We know that a high percent body fat, or extra body fat around the middle, puts you at particularly high risk for diseases such as diabetes or obstructive sleep apnea. If your BMI is greater than 30 and you have not been successful in losing weight through diet and exercise alone, you may be a candidate for weight loss surgery, or as doctors call it, bariatric surgery. For many of our patients, surgery improves or even cures illnesses related to being overweight, such as diabetes, sleep apnea, high blood pressure, joint pain, and infertility. In fact, we know from excellent studies in Europe and the US that patients who have bariatric surgery are more likely to be alive in 10 years when compared to similar patients who tried to lose weight with diet and exercise alone. In other words, this is not just about looking and feeling better, this is about extending your life.
I've had a weight problem my entire life, and I've lost weight, gained weight, lost a lot of weight, gained a lot of weight back. And I think, that cycle obviously was part of the reason I decided to finally have the surgery. But I think too is just I had children, and I wanted to be a better role model for them. I wanted to be able to run around, chase them. I want to be able to I'm gonna cry. I want to be able to teach them to be active and healthier, and be able to go to their sport games and play with them, and not be like the fat mom on the sidelines who can't, run with her kids. So I worked with a bunch of surgeons, I told you, that I could have had my surgery with, and I chose not to because Dr. Bhoyrul was highly recommended. So there were some people that I had worked with who had recommended him. And the first day that I came to see Dr. Bhoyrul, he made me feel so welcomed. He hugged me right away, and as soon as he hugged me, I thought, oh, this is somebody who I can trust to have my surgery. He just, come in here, dear, give me a big hug. And he hugged me, and he said, we're building a relationship for the rest of your life. I would recommend Dr. Bhoyrul and Dr. Fahrenhall, because I've had a lot of follow-up with her too in the hospital, and they've just been very wonderful. They've caring. They know my family. They were just wonderful people who made me feel really comfortable and confident that my surgery was going to go well, and everything was going to be okay.
The most common types of weight loss surgery we perform at Olde Surgical are sleeve gastrectomy, gastric bypass, and lap band surgery. We also perform multiple types of revisional surgery. Our experience in weight loss surgery is over 15 years and thousands of patients. My partner, Dr. Bhoyrul, wrote and co-edited one of the original textbooks of laparoscopic surgery in 1993. I am the first surgeon in San Diego who completed formal fellowship training in robotic and single-site surgery. Our combined experience and expertise means that we are unique in San Diego County in having performed all of the common weight loss operations, and in our ability to help you choose the option that is best suited to you and your needs. All of our surgeries are performed with the intent of causing the lowest complications, the least discomfort, and the fastest recovery. As surgeons, the two most common things we can do to affect weight loss are reduce the size of your stomach, which reduces the number of calories you can intake, called restrictive surgery, or reroute the digestive tract, which reduces the number of calories you can absorb, called malabsorptive surgery. We at Olde Surgical are proud to offer robotic surgery to our bariatric and general surgery patients. Robotic surgery offers a couple of distinct advantages over regular laparoscopic surgery. The optics for the robotic surgical platform are in 3D, allowing better visualization and dexterity while operating, which can lead to better patient outcomes. The robotic platform allows the surgeon more flexibility in deciding how to complete a patient's operation. We can choose the technique that is best for you and your anatomy with the robotic platform. Furthermore, the robotic technology continues to get smaller and smaller. We currently have the capability to do single-site robotic surgery, which allows us to complete an operation with only one incision hidden in your belly button. This is a huge advantage for our patients. Dr. Bhoyrul and I are committed to staying on the cutting edge of robotic technology. I am the first surgeon in San Diego trained on the newest robotic surgical platform, the Da Vinci Xi. As the technology continues to improve, we will stay out in front, offering the best of robotics to our patients.
The simplest and most reversible form of bariatric surgery is the lap band surgery. With this surgery, we take the lap band, which is essentially a silicone ring with an inflatable inner balloon, and we place this band across the upper part of the stomach. We place the band across the vagus nerve. That's actually the nerve that makes you hungry. Once we place the band, we stitch the stomach across the band to stop it from slipping out of place. Now the band is connected to a tube and the tube is connected to a button, and the button is implanted underneath the skin on the left-hand side of your abdomen. The surgery typically takes us about half an hour to 45 minutes. Most patients go home the same day. They can usually get back to work in about a week or so. And then, after the surgery, our patients follow up with us. This is really important. Our patients come and see us at least once a month, every month. They see us for two reasons. Number one, quite frankly, is accountability. If you know that you're seeing us, you just make better choices. In addition to that, when you come and see us, we'll ask you how much you're eating, we'll ask you how much you're exercising, and then accordingly, for the first few visits, we'll make some band adjustments. One of the nice things about the lap band is the fact that we can adjust it. By that I mean, if you're not losing enough weight, we can put some more fluid and make the band a little tighter, and that'll help you lose some more weight. Or, if you're losing too much weight, or if the band is just a little too tight, we can let it down by taking some fluid out and make you feel more comfortable and have you even gain some of the weight that you may have lost. At Old Del Mar Surgical, we've actually performed more lap bands than any practice in San Diego. Nevertheless, sometimes complications can happen. There are actually three things that could go wrong. Firstly, the band could actually slip out of place. So what we try and do at Del Mar Surgical to prevent it from slipping out of place is we stitch the stomach across the band to hold it in place. The next thing that can go wrong is the band could actually erode. That means it can cut from the outside of the stomach to the inside of the stomach. We try and prevent that from happening by using one of these modern low pressure bands, which seems to have one of the lowest erosion rates in the world. And then the third thing that can go wrong is this little port that we implant underneath the skin. Well, sometimes this port can also flip out of place. So I'm very proud to say that in our practice, before we implant it, we stitch the port to a little screen to hold it in place. Very much like putting stabilizers on a kid's bike. Despite the fact that we have done hundreds, if not thousands, of these operations at Del Mar Surgical, complications can occur. I'm proud to say that our complication rate is less than 1% in the first year after surgery. Laparoscopic sleeve gastrectomy is actually one of the most common operations for weight loss in the world today. In this operation, which we perform laparoscopically or robotically, we remove the part of the stomach that stretches to store large amounts of food, and we leave behind the part of the stomach that produces digestive enzymes. This actually has the advantage over the lap band of not having an implantable foreign body, and has the advantage over the gastric bypass of not causing malabsorption. The typical weight loss for a sleeve gastrectomy patient is about 50 to 70% of the excess weight that they need to lose, or somewhere in between the gastric band and the gastric bypass. In fact, we think sleeve is ideal for patients who have somewhere between 80 and 100 pounds of excess weight to lose. The surgery usually takes us about 45 minutes to an hour and a half. Most of our patients do spend the night in hospital, and we recommend that you try and take 1 to 2 weeks off work. At Old Del Mar Surgical, we typically perform several sleeve gastrectomy operations every week, and as a result, we have one of the largest ongoing experiences in San Diego County for laparoscopic sleeve gastrectomy. The main risk of the sleeve gastrectomy is actually a leak from the staple line after the stomach has been divided. And this seems to happen mainly in the first 2 weeks. Now, in our practice, what we do to prevent these leaks is several additional measures. Firstly, we use 3 rows of staples. Secondly, we reinforce the staple line with a synthetic dissolvable strip. And finally, we oversew the staple line with some absorbable stitches, especially in the upper part of the staple line where the leaks are most likely to occur. I'm glad to say that as a result of our vast experience and our refined technique, the chances of a leak in our hands are actually below 1%. And of course, once you're a few weeks out of the surgery, it is highly unlikely that you will ever experience a leak. Patients really enjoy the quality of life after a sleeve gastrectomy, perhaps more so than the other operations, because it really imposes very few limitations on what you can eat. In fact, other than eating a lot less than you ate before and not really feeling very hungry in between meals, there are really very few noticeable changes after the surgery. In fact, the biggest attraction of the sleeve gastrectomy is that other than your profound weight loss, most people around you will never even know that you've had surgery. Although laparoscopic sleeve gastrectomy is a very safe and an effective surgery, our concern is that you could gain your weight back after the surgery unless you participate in the entire follow-up program. So, at Olde Delmar Surgical, after we do the sleeve gastrectomy, we have a very tight program. We ask you to come and see us at least once a month, every month, and then on top of that, we even offer you mobile apps so that while you're at home, we can track what you're eating, track your physical activity, and even track your weight and your body fat. So you see, the surgery works, but you've got to follow up. Otherwise, you will not get the best possible result. For over a third of our patients, laparoscopic gastric bypass might actually be the best surgical option. In fact, we think that for patients who have over 100 pounds to lose, and even for patients who have diabetes and patients who like a lot of sweets, the gastric bypass may actually be the best operation. At Olde Delmar Surgical, we have actually performed thousands of gastric bypasses and have been performing this now for well over a decade. In this operation, which we perform laparoscopically, we start off by dividing the stomach into a small pouch, and we actually leave behind the rest of the stomach. You see, the rest of the stomach actually produces some important enzymes which we want to keep. After we've divided the stomach, we follow the intestine downstream, and then we actually divide the small intestine, and we create a new channel of small intestine that we call the roux limb. This roux limb, which is typically somewhere between 85 and 100 centimeters, is then connected to the small stomach pouch that we just created. The roux limb is connected to the stomach pouch upstream and the rest of the small intestine downstream. Now, this surgery works in three distinct ways. Firstly, as you fill up the small stomach pouch, you feel full on a very small meal. Secondly, and this is what's really unique about the gastric bypass, because the food does not enter either the rest of your stomach or the first part of the intestine, which is where you absorb a disproportionate amount of your calories and fats, you're not going to absorb food like you did before the surgery. And not only would you lose weight perhaps faster, but you'll also lose body fat faster. And for some reason, many of our patients with diabetes find that their diabetes goes away within just a few days of gastric bypass. The third way, and this is equally important, the third way in which gastric bypass works is when patients eat foods that are dense in calories or high in sugar, they get a negative sensation known as the dumping syndrome. This dumping syndrome, funnily enough, leads to a pretty healthy avoidance of foods that are really high in calories like candies, cookies, ice creams, and sodas. So as a result, gastric bypass patients do really well, and they typically lose about 80% of the excess weight that they have to lose, and very, very often lose well over 100 pounds. At Olde Delmar Surgical, performing laparoscopic gastric bypass typically takes us about 1 to 2 hours. Most of our patients go home in 1 to 2 days, and we strongly recommend that you plan on taking somewhere between 2 and 4 weeks off work. The complications that can occur from gastric bypass are uncommon, but important to mention. The staple lines that we use to divide the stomach can sometimes leak. So in our practice, we've refined the way in which we perform the stapling, and we also reinforce the staple line sometimes with synthetic mesh or with stitches. So in our practice, the chances of a leak are actually well below 1%. The next complication is malabsorption. You see, the part of the stomach that we bypassed is also important for absorbing some really important nutrients like vitamin B12, calcium, iron, and vitamin D. So if you have gastric bypass surgery, it's really important that you take the vitamins that we're going to prescribe for you. And it's also very important that you have a blood test at least once a year to make sure that you do not have any nutritional deficiencies. Finally, after rapid weight loss, some patients can get a hernia that occurs inside the abdomen, or something known as an internal hernia. That hernia sometimes happens between the ru-lim, that channel of intestine that we use, and the rest of the intestine. At Del Mar Surgical, we do our best to prevent these internal hernias by closing up any potential spaces at the time of the original surgery. You see, over the years, we've evolved our techniques to prevent the vast majority of these complications, but nevertheless, they can happen and do happen about 1% of the time in the first year after surgery. With gastric bypass, as with other weight loss surgeries, there is a risk that if you do not make the prescribed changes to your diet and your lifestyle, you could gain the weight back. And so at Old Del Mar Surgical, we have a very rigorous follow-up program. We see our patients at 2 weeks, a month, 3, 6, 12, 18, and 24 months after the surgery. And if you'll let us, every year for the rest of your life, because we really think that you got to make those changes and you got to stick with them for the rest of your life. Gastric bypass may or may not be the best surgery for you, depending on your needs and your expectations. So when you come to Old Del Mar Surgical, you'll get to work with a whole team. Not only will you see the surgeons, but you'll see the dietitians, the psychologist, you may see some other doctors, you'll meet our nurses, you'll meet the entire practice. And once you've met us, we'll make a recommendation to you. You get to have the final say, but we'll certainly tell you whether we think you've chosen the operation that best suits you. Many patients, especially patients who had their surgery a long time ago or did not receive the best follow-up or had a surgery that was outdated or have had complications, have not lost as much weight as they thought they might, or may have even gained some of their weight back. And so for these patients, revision surgery can offer a very important second chance at losing weight. For patients who want revision surgery, it is critical that we study their lifestyle and their dietary choices. It's important that we understand the stresses in your environment, and it's also important that we understand the anatomy of their stomach. And so participation in our very carefully supervised program, both before and after the revision surgery, is critical. In our practice, we start off by performing an X-ray study or an upper GI and sometimes an endoscopy to look at your stomach, to see what your current surgery looks like, and also to formulate a plan to improve your outlook. Over the years, we have performed hundreds of revision surgeries, including conversion of gastric band to sleeve or gastric bypass, including revision of a previously performed gastric bypass. We've also revised older operations like the old-fashioned stomach stapling known as the vertical banded gastroplasty. Some patients had an operation called the jejunal-ileal bypass or the duodenal switch. We've revised both these operations. And sometimes we've gained additional weight loss for gastric bypass patients by converting them from a proximal gastric bypass to a distal gastric bypass. Although we do perform the vast majority of revision surgeries laparoscopically, there is certainly a higher chance that we may have to perform open surgery. And in fact, the risk of revision surgery is always higher than for patients who have not previously had stomach surgery. Although thankfully in our practice, we have not experienced any serious life-threatening complications. If you've had previous weight loss surgery, but need to get better results, well then come and see us. And we'll formulate a plan. That plan may or may not include more surgery, but it will definitely include state-of-the-art follow-up.
My father died about 10 years ago, and he had been sick for years. Had high blood pressure, heart failure, diabetes, a whole bunch of things. And he was pretty sickly. So he lived till 81, which is a pretty long life, but he was sick most of the last 10 or 20 years. And I'm not looking forward to that. I mean, that's not what I have to expect at this point. My experience here has been pretty exceptional. It's going to make me a little bit emotional, which I didn't expect. The whole trip with weight loss and being overweight, even though I said I wasn't depressed, you know, I've got to admit that there's times when it was a burden. And I remember when I finally decided to talk to Dr. Bhoyrul because other things had not been working, and I had a visit with him, and I knew about the bypass, and we were sitting in the exam room, and I said, I'm just wondering if I would be, and I started crying then, a candidate for the bypass. And he got up and he hugged me, and he said, absolutely, I've been waiting for you to come talk to me. So it was, I don't know, cathartic. It was quite an experience. He's a very compassionate guy. You know, it's easy to focus on Dr. Bhoyrul because he's the face we put on the practice, but it is everybody that's here, and I can't say enough about them and how they've made the experience a positive one. Since I work with people in my occupation, being confident about my presentation is real important, and I'm aware of the change, and it's one of the things that I really enjoy about it is that I feel better about me.
So let's talk about life after surgery. The results from surgery are truly excellent. Not only do our patients lose a lot of weight and feel very good about themselves, but the vast majority of our patients will prevent or even reverse some of the chronic illnesses that are associated with being overweight. Illnesses like diabetes, sleep apnea, cholesterol, blood pressure, joint disease, and even depression. So these results are fantastic. Having said that, surgery on its own is only a tool for an excellent outcome. And here at Old Delmar Surgical, we support you with all the other things that you need, with the follow-up that you need in order to get that excellent outcome. In fact, I would contend that our support is not only truly unique, but is far better than anything you'll find out there. Not only do we have a structured follow-up program where we see you on a regular basis, sometimes every month, sometimes more or less than that. At every follow-up program, we'll tell you how to eat, we'll tell you how to get physically active, we'll tell you how to exercise in order to lose fat and maintain muscle, we'll check on your blood test, and we'll even give you the right multivitamins. So that's good. But we have something else down here that makes us even more special. We have something called RevUp. See, we have a mobile app so that when you're at home, you'll be stepping on a wireless scale at home every day. We'll find out every day how much you weigh and what your body fat is. When you're at home, you'll be wearing an activity monitor. We will monitor your physical activity while you're at home. We'll ask you to log your foods with a mobile app. So just by taking a photograph of what you've eaten in the office, our dietitian will know exactly what you've eaten every day. All that information comes to us. All that information we review on a daily basis, and we give you the feedback that you need to get the best possible outcome. There's truly nothing else like it. And of course, at the end of the day, with all the electronics and all the mobile app, you still come and see us. RevUp is a program that was developed and patented by our sister organization, MD Revolution. We give all our patients a wireless scale that measures their weight and their body fat at home, an activity tracker to track your physical activity, and a heart rate monitor to track your heart rate while you're exercising. Finally, all our patients get a mobile app that allows you to log your food simply by taking a picture of your meal. All this information that we collect from your wireless scale, your activity tracker, your heart rate monitor, and all the photographs that you send us of your food go wirelessly into a digital platform. And then, here at Delmar Surgical, we look at all that information on a daily basis. We assemble it, And then we send you weekly messages via your mobile app to tell you how you're doing, and we give you pointed instructions on how to improve your result. All the devices that you need are stocked in the office, and signing up for the program costs remarkably little if you have health insurance, and if you're paying for the surgery out of pocket, we include the program in the cost of the surgery. You see, as a result of RevUp, we now have the most intensive and robust follow-up program available in the world. And we're also able to support our patients wherever in the world they are, as long as they have internet access and a smartphone. I think you'll really like RevUp.
I've lost 20 plus pounds, and that has increased my energy levels. It's increased my ability to get a good night's sleep, and obviously I feel, super confident, way more confident when I came in to begin with. Obviously, I came into the program thinking I was going to have some health benefits, that there were going to be obvious changes. I was very focused on losing weight, not just, my overall health. And one of the things I learned is that it was way more than just a number on a scale. It was way more than just losing weight. My first assessment, I learned about visceral fat and internal fat, and the stress that puts on your heart, and your health and the length of life. And you could be, you could be 20 pounds lighter and not have that internal health. And it kind of shifted my thought on, wow, I just wanted to get a pair of smaller pants, and now I want to live longer. I really like things to be easy, and it's like having an actual conscience, a little angel or a little devil on my shoulder. I can't get away from not doing the exercise, or doing it right, or doing it too little or for too long, because I get these messages that say, hey, I just saw that you worked out, you did a little too long, or you got a little too high in the heart rate zone. How are you? Was it easy? Was it difficult? And the same with my eating. I think you got to get a little more greens in. It's like somebody's watching me all the time and telling me, you're doing it right, or you're not doing it right. And something that's proven to work, I think, is what everybody looks for, right? Everybody looks for that thing that's going to guarantee to work. And it works.
At Old Del Mar Surgical, we want to take you from the beginning to the end of your weight loss journey. And this includes offering cosmetic surgery options. Major weight loss can lead to some pretty big changes in your body. With adequate protein and exercise, the majority of these changes are positive. However, despite hard work and a good diet, many patients end up with areas of unwanted fat that they just can't burn off. I'm the first bariatric surgeon in San Diego trained to do Smart Lipo. Smart Lipo is a minimally invasive laser liposuction that targets areas of stubborn unwanted fat and helps tighten skin. The Smart Lipo laser is called triplex and has 3 different wavelengths to target 3 different areas. The first is fat obliteration, the second is reduction in bruising, and the third, which is particularly important for our bariatric patients, is skin tightening. Tighter skin can get you the look you want wearing the clothes you want. There are a variety of body sculpting options out there for weight loss patients. I will walk you through all available surgical procedures and help you choose the option that's best for your lifestyle and your body.
I'm proud to say that at Old Del Mar Surgical, our team has some of the most satisfied patients and has won numerous awards. Dr. Bhoyrul is the Chief of General Surgery and the Medical Director of Bariatric Surgery at Scripps Memorial Hospital. He has been nominated as one of the top doctors in San Diego, and for the last 8 years has been selected as one of the best doctors in America. Dr. Fahrenholt is the first fellowship-trained robotic surgeon in San Diego and the only bariatric surgeon in San Diego to provide office-based laser cosmetic surgery. Both our surgeons are board certified and have trained at world-renowned institutions. Dr. Fahrenholt graduated summa cum laude, top 1% of her graduating class from UCLA, went on to medical school at UCSD, and received her surgical training and fellowship in advanced laparoscopic and robotic surgery at UC Davis. Dr. Boyle completed his undergraduate and medical school in Scotland, is a fellow of the Royal College of Surgeons of England, and completed his surgical training at Stanford University and fellowship in advanced laparoscopic surgery at UCSF. Our practice is part of the Center of Excellence accreditation awarded to Scripps Memorial Hospital, La Jolla. Our patients receive the best that private practice has to offer. In addition to the knowledge that their surgery will be performed by renowned and skilled surgeons, our office philosophy is centered on having a team approach and personal patient care as the standard. You will receive a warm and friendly reception where the staff will get to know you on a first-name basis, and the dietitians and psychologists will provide support that hopefully you've never experienced before. Our medical assistant and nursing staff will take care of all of your logistical and medical questions. We have insurance specialists and billing staff that make every effort to ensure that you have no surprises by verifying your insurance benefits prior to your initial visit and help seek the most cost-affordable option for you. We also have financial payment options that some patients may be eligible for, and we take nearly all insurance plans that allow you to choose your own doctor. However, if patients have any financial or insurance concerns, our office will always be here to guide you throughout the entire process.
I had to come to terms that I was in a very, very, very dark place, and if I was going to continue to live, I had to change how I did so. So I came to a seminar when Dr. Bhoyrul got up to speak, and he was an actual person, and he had this whole different philosophy on what I was struggling with, and none of it had anything to do with me being a horrible person or me being lazy or me being wrong. Like, he introduced my weight problem as an eating disorder and something, you know, he just put it in a perspective that made it seem manageable. If you're looking for a place that will not only present you your options but walk you through them, I feel like this is where somebody will come. I got a doctor and a dad and a friend and a coach and, you know, a whole family of people that walked with me at my pace and stayed with me, you know, when it was hard, and picked me up when I gave up. And I live in a world now that I have the ability to pretty much do everything that I used to sit on my bed and be like, oh, that would be nice. I've climbed a mountain, and I've walked in 5Ks, and I learned how to ride a bike, and I've done all these crazy things that just weren't even fathomable back then. I just feel like if I could talk to anybody that was where I was 3 years ago, I would just walk them here myself.
From all of us here at Old Delmar Surgical, thank you very much for taking the time to watch this seminar. We really hope you found it useful.
We hope you enjoyed our online video seminar. Please give us a call at 858-457-4917 to schedule an appointment. You can also fill out our questionnaire on the website, and our office will follow up with you. If you're not sure if we take your insurance, or if you're not sure you can afford surgery, or even if weight loss surgery may not be an option at this time, we still encourage you to come in and visit us, getting a free body composition analysis. We welcome you to meet each of our staff to see if this is the right fit for you. Just ask for our complimentary meet and greet visit. We look forward to working with you.